Um, is it visible?
Yeah.
Yes,
It's
it is good.
Okay. So, namaste and good evening, everybody. It's been a great pleasure and a privilege to be on this platform and be able to present something in amongst all you stalwarts of hypnotherapy. Thanks to Dr. Palansa, and thank you, everybody. So, my presentation today is Fear to Freedom, the Inner Journey of a Student. I'm Dr. Puja. I'm a dentist by profession and also a hypnotherapist at my heart. It gives me great pleasure to be here. Fear. So as we all know, no matter how negative this word may sound, the fact is that fear is the driving force of life. It is the fear of failure which makes us work hard and achieve success. It is the fear of being rejected in a relationship that makes you give your 100% to any relationship. And more than anything else, it is the fear of death which makes us live a better life. So, in the right sense, at the right time, and in the right amount, fear is really useful to us. But as it is rightly said, anything which is too much becomes poison. It's the same with fear. And today I would like to share with you a case which I had faced in the year 2019. So I had this 16-year-old girl who was studying in the 10th board exams and in the 10th standard, and she was supposed to face the board exams in March 2019. In the month of January, I got a call from her mother. They were from Bharuch, which is a city in Gujarat. And the mother was quite tensed about her daughter because she was as such a very intelligent girl, from a very well-to-do family. But in the past 1 week, every day she had been having attacks of panic. She used to cry for 1.5 hours after her lunch and get exhausted crying, after which she would have a severe headache. And then she would try to sleep, not able to sleep. She would try to study, not able to study. She would spend the next 3 to 4 hours just trying to do different things, but was not able to focus on anything else. And by the late evening, what used to happen was she would feel so exhausted mentally and physically that she would fall asleep at odd hours, maybe say around 8 o'clock, and then again wake up in the middle of the night, then again not able to sleep. So as you can understand, the entire schedule of a student, which is when you're approaching the exam, at that time you have a very set timetable, but this student was not able to adhere to her timetable. So what happened? Basically, she was facing typical exam fear. I asked them to come down, and when they came to me, the very first thing that the girl told me was, I'm very scared. I am a good student. I know that I can do well, but somehow I'm very, very scared that I will fail in my exams or I will not be able to write my exams properly. The one thing very typical over here was, usually we see that in these kind of cases, we would like to know what is the parent's approach, because many a times, knowingly or unknowingly, it is the pressure from the family which makes the child undergo so much of stress and worry. But in this particular case, both the parents were very, very cooperative. She was the only child. They did not have any high expectations, though they knew that their daughter could do very well, but still they were very fine with it, even if she scored a little less. The issue was that the girl had inflicted expectations on her own self. She had burdened herself with getting great marks, and probably because of that, she was facing this kind of stress. In the very first session, she was explained about the mind, the conscious and the subconscious mind. And a simple practice of breathing awareness and progressive muscular relaxation was done with her. Soon after the session, the first thing that she told me was she was feeling very light in her head and she was also feeling relaxed. the main concern of both the daughter and the parents was, one, the crying attacks that she used to get, and secondly, how will she study if she keeps crying so much, if she remains so disturbed. However, I told them that things will be okay and she is supposed to practice breathing awareness and PMR every day. Since it was already January, she was going to face the exams in March. Also, they were coming from a city which is 2 hours away from me. So we decided to have a little frequent sessions so that she could get back to her studying routine and face the exams in a good and positive manner. So after 4 days, I had recalled her. She reported that there was a good reduction in the episodes. The first 2 days, she did cry a little bit, but it was not very bad. And on the the third and the fourth day, the episode had reduced a lot, but she still could not study. And even her sleep patterns were still irregular. Another thing to be noted over here was, there was also a reduction in her appetite. So in the second session, I further asked her a few questions about her studies, about her friends, because I realized if it is not the parents, maybe there is either some kind of a peer pressure or maybe something from her teacher's end, which has made her inflict this kind of a burden on herself. At that time, she told me that there was this one girl who was her best friend. They were very good friends. They used to come and go to all tuitions and schools together. But this girl, her friend, was very, very curious to know all the time, what did my client study? So she would call up several times in the day to ask, which chapter did you study today? Which subject do you study today? Do you know the answer to this question? And because of this, slowly and gradually, the girl had started losing confidence, because when her friend used to ask her on the phone, she would suddenly forget the answers. And that made her feel that even in the exam, she will not be able to recollect whatever she is reading, because of which she started facing this kind of a exam stress. So in the second session, again, I explained to her about the ego, explained to her the process of ego strengthening, and we did a session, after which again, she told me that the imaginary which I had given of a garden, she had really enjoyed that imagination. And after a very long time, she had visualized something, because till then, in so many days, the past 2 weeks when she was suffering and the 4 days after the therapy, she was somehow not able to recollect her dreams, or she was not able to visualize or imagine anything. So in this way, she really felt good after the session, because in her trance, she could imagine something beautiful. After this session, again, she was advised regular practice of PMR and ego strengthening. Also, I had told her that whenever it is possible for her, she would also do breathing awareness 2 or 3 times a day, as we always advise. Now, I gave her this session of ego strengthening to be practiced for a good 10 days. And in between, I had asked her to give me a short feedback either over the phone or WhatsApp. And at that time, on the third day, she called me to tell me that she was feeling much better. She had stopped crying in the last 3 days, absolutely. Also, she asked me how to get back to her routine. On that, I had suggested her, usually her routine before all this issue was that she would study in the morning, then take a break in the afternoon, then again from late afternoon to night, she would study, but usually she would sleep the whole night. That was her routine, because as a student, she had a good sleep of 7 to 8 hours, and she did not want to compromise on her sleep except very close to the exams. So I just asked her to get back to that routine. Again, after 2 days, she told me that she was able to get back to the routine, although not 100%, but slowly and gradually she was able to study a little bit. Now, after third session, in the third session, she came back. Again, catharsis had stopped, but she still felt whatever she was reading, she was forgetting it. She would not be able to recollect anything during her exams. In fact, she also felt that particularly for social studies, she would not be able to write the paper. She felt that social studies was a very volatile subject. Whatever she was reading, it used to evaporate from her mind. And she also found it very difficult right since 8th standard. All these things she told me, after that, I had explained to her the effort and outcome theory. That is, that it's our job to give our 100% and then wait for the result. Also, thinking about the result, she would not be lowering her efforts, or she would not be getting tensed. In this particular session, we did a customized trance. That is, we did the bow and arrow imagery, in which I gave her specific auto suggestions for focus, concentration, and also for confidence. Because what I realized was she was able to study, but then she had the issue of recollection. A particular post-hypnotic suggestion was given during this session, that whenever she would hold the pen in her hand, she would feel very confident and be able to recollect everything comfortably with a calm and relaxed mind. Also, in this particular session, in this session, we did the bow and arrow. She was again asked to practice that. In the fourth session, when she came to me, that was soon after the bow and arrow imagery, because she was nearing her tests in the tuitions. So at that time, again, I asked her to just get back to me. In that particular session, I taught her about the ECC versus TTF, that is energy, concentration, and confidence versus tiredness, tension, and fear. This method was taught to her, and I asked her to practice this several times in a day. Also backed up with PMR, which was now in a lesser consistency. I asked her to do the PMR, particularly whenever she wanted to relax after her studies, like when she was taking a break. And the ego strengthening and bow and arrow imagery were continued. Well, the outcome of this particular case was, after the first session, there was a reduction. Her entire routine of studying and sleeping resumed after ego strengthening. And particularly for SS, when I had given her auto suggestions, that was, again, sorry, I forgot. It was during the bow and arrow imagery, where I had also given her specific auto suggestions for social studies. She scored 94 out of 100 in the boards, which was the highest in her class. And I still remember the day her result was declared, I was the first person she actually called up. And that, I think, was my biggest reward. She also continued her practice for trance at times whenever a difficult situation in studies arose again. She always kept in touch with me. She loved the ego strengthening recording, so she used to hear that very often. Also, the bow and arrow, she used to continue in her 11th and 12th. 12th entrance, she gave the JEE. Presently, she is in her computer engineering at the Charusat University itself. And she is doing very well with very high regards for hypnotherapy. So from this particular case, what I really took back home with me was that fear is necessary. Fear of exams is necessary because that really makes you put in your best effort. But the fear of forgetting things, the fear of not being able to perform well, the fear of not being able to write properly in the exam in those 3 hours, the fear of a particular subject or a particular chapter, that can really hinder a student's progress. And if hypnotherapy is the right tool to help her, then why not? Thank you very much. With this, I end my presentation of the case. Thank you.